Good evening to all the viewers who are watching live and will be watching on the recorded version. So, guess what? As per promised, we are back with auto e participation certificate. So, this was the news before starting the CME. All the good news to you, and as promised, we have started from 9th November. You will get, all you have to do, just go down the link. It's given in the description below. Just click on the link and you will get you have to fill up just few details, and after that you will get your CME thing, the CME auto participation certificate. So the issue has been cleared after several months, and I hope we get a good response. So without wasting any more time, let's just jump into our 30 seconds countdown time. And oh, before that, it's the first time we are starting live today at 8 p.m. So hats off to us. So with this, let's start with the countdown time.
Good evening, sir. Good evening, all the NHians and the homeopaths across the globe. We are really privileged to have tonight three different people in our CME. All are student teachers, a great bondage between the faculty, the alumni, and the administration. Now, sir, the theme what had started way back in 2020, in 2025, we had came across 126 episodes. Today is 127. A great journey for so many years, and will continue in the days to come. And with that, we also are eagerly waiting for our grand alumni meet on 12th of December. Now, countdown had started, 32 days to go, 32 more days to go. We are getting enormous response from all over the country, even from our alumnus of out of India. All are willing to come, but due to some constraints or some other issues, challenges, uh, they are trying to get in touch. And we had almost completed 500 delegates plus. We are waiting for some more reconciliations, and we will be publishing batch-wise delegate chart in the closed WhatsApp group very shortly. Now, before wasting any further time, with your permission, sir, let's call on our inaugurator tonight. Sir, our inaugurator, Dr. Rajbala, UG from NIH Kolkata, and now PG scholar, PGT from NIH Narela. Over to you, Dr. Rajbala. Dr.
Good
Rajbala
evening,
Gupta.
everyone. Respected Dr. Kalyani sir, Dr. Bidyut Mukherjee sir, good evening, and all the participants joining us today. I would like to express my heartfelt gratitude to the NIH Alumni Association for giving me this wonderful opportunity to serve as the inaugurator of today's 127th online CME. So I am Dr. Rajbala from 29th batch PHMS from NIH Kolkata, and currently I am pursuing MD at NIH Delhi. It fills me with immense joy and pride as NIH has given me countless experiences and lifelong learnings that continue to shape my journey. So coming to today's 127th online CME, The topic is the repertorial approach in antenatal care, bridging classical principles with modern maternal health. So I'm sure this session will bring valuable insights for all of us. Now it gives me immense pleasure to introduce our today's speaker, Dr. Heena Siddiqui ma'am, 23rd batch MD from NIH Kolkata, currently working as Senior Research Fellow at CCRH New Delhi. I also feel specially honored to share this platform with Dr. Shishir Kumar Singh sir, Head of Department of Physiology and Head of Department of and in charge of Pediatrics. His constant guidance and dedication has been a true source of inspiration for many of us. Welcome to our moderator to take the session forward. Welcome, Dr. Shishir Kumar Singh, sir.
No sound is audible to me, Arkoji. Hello.
Sir, the process is that you will call up our speaker today. So that's why, sir. You will call up our speaker.
Sir, no sound audible to me.
Sir, turn on your camera if possible. Once. To all the viewers, please wait. We will come back to you shortly. Just wait until then. We will get back to Sisisha via telephone. We are trying to get to him with that. So, taking you on backstage, and it's up to you, Dr. Bidyut Mukherjee, to just what to do on the next part. Like, what should we proceed with now?
Uh, okay, Rajbala or Heena, kindly call Shishir and request him to
He's on
join.
stage. He's on stage. Yes,
He's
yes, yes.
in.
He's on stage. Yes, yes, yes.
Great, great. Love to back you. Love to have you back on screen.
I
Sir,
guess
audible? I'm
he's.
audible.
Sir, you're
Yeah.
audible.
No sound is coming to me, sir. Hello.
Shishirji, please rejoin again.
Hello.
Shishirji, please rejoin. Also, can you write in the message?
Okay, I am contacting him if possible. So let's just continue with move on to the next process if possible.
Okay, okay. Uh, Also, please guide Shishir sir with the joining process. And in between, let's discuss a few points on our alumni meet.
Okay.
Welcome. We are really sorry to keep Hena on wait. And she has been a tremendous speaker, what I had seen. Sir, alumni meet after 2022. And we all are so eager to meet each other. Even today morning, I had received several calls from senior dependent stalwarts, from Ishwarada sir, from Nirupama madam, from many other senior dependent teachers and stalwarts. And all are so eagerly waiting for the date of 12th. So we have a lot of plans for 12th, like we'll have a whole day fun-filled session starting from registration, which will be from 9 to 10. From 10 to 10:30, we are planning to have the inaugural session. Everything has to be finalized. It's just somehow we are getting the things done synchronized. We have a lot of protocols to follow. And from 10:30 to 2, we will be having what we have planned in the executive committee. We will be having exciting interactive sessions with the alumnus only, batch wise. Our suggestion came from various experts that each batch will be proposed to tell a few salient features about their batch. Only one person from the batch. They will come on the stage and they will share their views within a short period of time. We'll be publishing the batch-wise delegate list, and very unfortunately, we are yet to have three batches uh, as a delegate, one single doctor from three batches, like probably 20th batch of BHMS and 18th or 19th, and somewhere two batches of MD and one batches of BHMS, one batch of BHMS. So until and unless we get those batches, there are several uh, delegates who are several batches who are having on one single delegate. So we will request all of our delegates who had already registered their name online through our website www.nihaa.in. Please update your details over there. Oh, Dr. Shishir is here. Welcome back, Dr. Shishir. Can you hear us?
Yeah, sir. Yes, sir.
Oh, that's great. Please put on your camera. The stage is all yours. Shishir sir, the stage is all yours. From here on, you will conduct the CME.
फिर साउंड चला गया. हेलो.
Shishir sir, can you hear us? Shishir ji, can you hear us?
I guess there is one more problem again. I will contact him again once.
Okay, just guide it. As we are discussing about the alumni meet, please, those who are yet to get yourself registered online, please register yourself. Many people had paid. The bank reconciliation is going on with the accounts department team. We are trying to get it done by tomorrow evening, if not by Tuesday morning or day. And in between that, there are several delegates who are yet to register their names online. www.nihaa.in. Please go through that website. You will see the link of registration. Please register your names over there. If you are paid by UPI, just put the UTR number or the online transaction ID, which will be reflected on your transaction receipt. If you are paid by check, please write the check number and mention check of so and so bank, of PNB, Bank of Baroda, SBI, like that. And that will help us to reconcile with your statement and the bank statement. So it's a Herculean task, and our team, NIH Alumni Association, is working hard day and night. We are excited to have a cultural part, that too with our Materia Medica in the background. This team is being headed, the cultural team is being headed by your beloved Professor, retired Dr. Usha, and her team, Dr. Ampriya, Dr. Professor Parthapratim Roy, Dr. Pragya Paramita Chatterjee, Dr. Afsar Ali, uh, and so many. Dr. Pubali, I am forgetting some names, Dr. Sukanya. So they are all planning up good things. They are planning up good things. We'll have lunch from 2 to 4. From 4 to 6, we'll be having this cultural part for the alumni kids, for the alumni spouses, for the alumni, PGT, and the students. 6 to 6:30, we'll be having the high tea, and from 6:30 to 8:30, we'll be having the cultural bonanza. We are back with Shishir sir. Shishirji, can you hear us?
Yes, sir, yes, sir.
That's great. Welcome back, Shishirji. The stage is all yours. Please carry on with the CME.
Thank you so much, sir. Respected Kalyani sir and respected Bidyut sir. Uh, so, as this is a good tradition that every uh, aspect of the homeopathy should be covered, and now we are having this CME especially on the topic of antenatal care, which is very much important. As if healthy mother is there, then there will be healthy child, and that will be healthy family and healthy society and healthy nation. So this is so much important topic that today Dr. Heena has taken, and I must appreciate her. Dr. Heena is uh, PG from NIH, and I have seen the hardworking attitude and the learning uh, she has done in the 3 years. And apart from the learning process, she was also very much active in spreading the awareness about homeopathy. So that thing I have seen, and this is also a commendable job. And today I'm very happy that I am moderating the session of Heena ji, or I must welcome that Heena. Please start your CME that everyone can enrich this what the important topic what you are going to discuss, because antenatal care is important, and to go through all the aspects we have to see how to repertorize also, you know. So that is very good aspect, and best wishes from my side, and we will listen from you.
Thank you so much, sir. Good evening, everyone. Am I audible, Dr. Akka?
Yes, you're audible. You're audible.
Yeah, okay.
Everyone can hear.
Hello, good evening, everyone. Thank you so much, Dr. Kalyani, sir, Bidyut, sir, and Shishir, sir, for your kind words, encouraging words. And it is an extreme privilege, it is an extreme honor, pleasure to be here in Alumni Association, CME, as a speaker. So I'm very happy and really honored. And this topic, repertorial approach in antenatal care, I think, yes, as Sir has mentioned, it is one of the most important topic which we hesitate somewhere to take. Being a if we see a pregnant woman or pregnant lady, we hesitate that to what if we prescribe and something happened to lady, something happened to baby, we should prescribe or not, or which medicine, which potency to be given, and so many doubts we all have while doing a prescription to ANC patient or ANC lady. So today we will dive into some of the interesting rubrics which we can use. And I have divided this whole presentation into three, according to three trimesters, and whatever complaints the lady suffers through or feels during each trimester, and what rubrics we can use, and how to differentiate medicine. That is the most important part. So yeah, again I will thank you to NIH Alumni Association for giving me this opportunity to have here as a speaker, and thank you to Dr. Alka Mukherjee as well for handling all this so nicely. Yeah, I think we will begin because we are already running late. It's 8:19. So yeah, repertorial approach in antenatal care, bridging classical principles with modern maternal health. Let's see how we can do this. So yeah, these are the content. Let's first see why I've chosen this topic for the presentation, and then we'll discuss further. And yeah, we all will agree that out of all the rights of women, the greatest is to be a mother. Nature intends that the physical and hormonal changes of pregnancy ensure the growth and development not just of the baby, but of the mother. The physical and emotional changes of pregnancy and then the experience of labor, birth, and breastfeeding play vital roles as women make the transition to motherhood. Homeopathy is a wonderful tool in this incredibly intense period of time for both mother and child. However, there is a noticeable hesitation among practitioners to prescribe homeopathic medication to pregnant women. Now, this presentation aims to address this concern by discussing effectiveness and safety of homeopathy for managing pregnancy-related complaints and instilling confidence in prescribing homeopathic remedies during this sensitive period. So homeopathy has, as we all know, that homeopathy has distinct advantage for treatment of health-related problems of women during pregnancy and in postnatal period as well. This therapy is safe, effective, and economical. However, it has been increasingly felt that to provide quality services, enhancement of knowledge and skills by interaction with specialists and sharing of experiences is required. In 2009, under Government of India's Health Project on Homeopathy for Happy Mother and Healthy Child program, CCRH undertook the initiative to prepare a model training program on the basis of which quality training on mother and child healthcare can be conducted for homeopathic physicians. Currently, the potential of homeopathy for treating pregnancy-related complaints is underexposed. Therefore, it is timely to discuss the effectiveness of homeopathy during pregnancy and encourage beginners to prescribe these medications with confidence. Now, what all? We have a lot of literature available which we can utilize for every different disease condition, for each and every disease condition, I would say, including ANC. So what all different books we have which we can use for ANC is Repertorial of Symptoms Occurring During Pregnancy, is the Couch's Emergency Manual, Homeopathy in Pregnancy. We have Borix Materia Medica and Repertory. We have this Murphy Repertory, Nurse Repertory, and we have this William Gentry's Repertory. Whole one volume is dedicated for this section. Now let's start first with the complaints. What all complaints a female undergoes through during her first trimester. And these complaints are morning sickness, breast tenderness, constipation, frequent urination, mood swings, and pica eating. So every female experience all these complaints, not all, at least one of these complaints during some or the other time during a first trimester. The intensity can differ, but definitely each and every female goes through these complaints. So let's talk about morning sickness first. Morning sickness. What all rubrics we have? In nerve repertory, when we go through nerve repertory, we have really beautiful chapter given in nerve repertory for pregnancy, and beautiful rubrics are there, which are not that much used. They are really underused. So we have in genitalia female pregnancy, morning sickness. And here we have remedies like lactic acid, Merck, Nux vomica, Seneca, and sepia. If it is with loss of appetite and diarrhea, the single medicine given is Sabina. With faintness, cannot rise from bed. Then during early months, sick during a walk, feels as if she must lie down and die. Kericap is a single medicine given in high grade. If there is constant nausea, the female is experiencing constant nausea, then MECCA we can think of. In complete repertory, we have rubrics like in stomach, vomiting, pregnancy during, headache with frontal, carbolic acid is the medicine. If there is obstinate vomiting, we have sorinum. If the vomiting is persistent, medorinum. Tylism with creocytum. Rising from bed is like defloratum. Rich food after ipecac and pulsatilla. Sadness with nux vomica. Soup after mecca. Uncovering abdomen ameliorating tobacco. So if there is nausea after night watching and mental disturbances after eating, the medicine given is pulsatilla. If she experiences vomiting with deadly nausea, tobacco, persistent late in afternoon and evening. Okay, only during afternoon, late afternoon and evening, if it is happening, lachesis is the medicine. With burning at pylorus, cantharis. Stomach rejects everything. Okay, asaram is the medicine. After supper, it is creocytum. Now, how to differentiate medicine? What all medicines directly we can look for? There is some therapeutic hints here. So you can see some medicines which we don't use, okay, usually, like cucurbita pepo. In this medicine, in this remedy, we have the symptom intense nausea immediately after eating or drinking, particularly of pregnant women. So if there is immediately, as soon as she is eating and she is experiencing this nausea, the medicine you can think of is cucurbita. And there is also seasickness present. In ipecac, as we all know, it is one of the most important medicine for nausea. So one continual sense of nausea all the time, also vomiting, and there is desire for dainties and sweets, or averse to either she wants to eat sweet or there is aversion to all the food. Nausea with salivation and hiccup. This is one of the important keynote that in ipecac you will see the person, the lady is experiencing nausea, but along with it, she will have a lot of salivation and hiccup is there. Okay, हिचकी आएगी patient को, nausea तो feel होते ही रहेगा, continual nausea will be there. In lilium tick, on the other hand, you will have vomiting from malposition of uterus, hollow empty sensation in stomach. And in Symphorecarpus, you have qualmishness with indifference to food, deadly nausea, violent retching, continuous vomiting, most comfortable by lying on back. Whenever she is lying, that too on back, not on side, that time only the patient will feel better. Otherwise, there will be continuous nausea and indifference to food. So कुछ खाने का मन नहीं कर रहा है, डॉक्टर साहब बहुत ज्यादा नौशिया हो रहा है और सिर्फ लेटे रहने का मन करता है और सीधा जब तक नहीं लेटो कंटिन्यू नौशिया हो रहा है. तो अगर ऐसा कोई सिम्टम आपको अगर कोई लेडी बता रही है तो यू शुड थिंक ऑफ सिम्फोरिकार्पस. Then apomorphinum. In this medicine, you will have vomiting. It is preceded by, there will be vomiting, but before vomiting, the patient will experience nausea, lassitude, and increased secretion of sweat, saliva, mucus, and tear. Like all of the discharges will be there. She will have salivation, tears will come, और स्वेट ज्यादा होने लग जाएगा, ठीक है, म्यूकस ज्यादा होगा, ऑल दिस, एंड उसके साथ बहुत ज्यादा थकान महसूस होगी पेशेंट को. पेशेंट विल बी वेरी टायर्ड. ओके, and with this there will be nausea, and this nausea will end into vomiting. The medicine is apomorphinum. In lactic acid, we have nausea and vomiting of sour substance, sour taste, no desire for breakfast, food seems to come up almost to mouth, but nausea is relieved by breakfast. Here you can see two contradictory symptoms. We can see that in lactic acid, here is no desire for breakfast. Patient will say, I don't want to eat. But as soon as she eats, okay, अगर बहुत फोर्स किया या बहुत ऐसे करके अगर उसने कुछ खा लिया, ब्रेकफास्ट कर लिया अगर पेशेंट ने, तो the soon she completes her breakfast, she will feel better. Nausea कम हो जाएगा. That is your lactic acid. In carbolic acid, we have vomiting of pregnant woman with frantic headache and irritability, nausea early in morning. जैसे morning में उठेंगे, morning sickness ही होती है, तो morning में usually patient experience that. But along with that, there will be headache, बहुत ज़्यादा headache होगा and irritability will be there. So if there is nausea, if there is irritability, if there is headache, and along with it, if patient is having vomiting also, carbolic acid is the medicine you can think of. Now, another important complaint during first trimester is breast tenderness. This is one of the complaint the patient will experience, but she can't share it with anyone, and she will keep, suffering from it. So how we can help it? Many times that patient even hesitate to share it with the doctor as well. So, but you should inquire it, and if patient is saying complaining of breast tenderness, we can look up in our repertory. In Murphy repertory, we have pregnancy, breast, hard knots. If there are hard knots on the, if you do just an examination, or if patient herself says that she is feeling that there are hard knots in the breast, then calcarea floor you can think of. Now, mind you that though we have rubrics and single medicine given, all this medicine should be prescribed only after considering the totality of the symptom. Just not because she's coming and saying that there are hard knots, you will give calcarea floor, okay, directly. You need to inquire or have a totality which matches with the symptoms, other symptoms of calcarea floor, and that then only we can prescribe the medicine, and then only we will be able to give result to the patient. So that is the only condition which we all should follow. Just don't do this like the you're taking notes and then directly going and you're prescribing the medicine. The totality of symptoms should always be taken into consideration before prescription. This is just to keep in mind that, oh, hard knot is there, we can think of calcarea floor, but also consider other symptoms. So moving on, if there is during pregnancy, if the breasts are painful, we can think of sepia. If there is burning during burning in breast during pregnancy, then calcarea phos. And if there is neuralgic pain, conium medicine you can think of, conium mechanism. In Boric repertory, we have rubrics like female sexual symptom in the chapter, female sexual symptom, complaints during pregnancy. We have breast painful, inflammatory. Now, mind you, here the word inflammatory has been given. That means what? Some sort of inflammation has been taken place, have been started in the breast, and that's why the breasts are painful. So we need to rule out what all conditions can happen. Okay, why this inflammation has occurred. And if it is there, definitely the first medicine we will think of is belladonna and then bryonia. And again, neuralgic pain is conium mac. Now, what are medicines we can think of? Sepia. When we have to prescribe sepia, consider the symptom that there should be shooting type of pain in your mammae, excoriation of nipples which bleed and seem about to ulcerate, nipples cracked across the crown. So shooting type of pain, guide to sepia. In conium mac, as we already saw, there is neuralgia. So breast will be flabby, inflammation of the mammary, the stitches, induration of the mammary gland with itching and shooting pain. So there will be neuralgic pain. Along with neuralgic pain, the patient will experience itching in breast. So that time can think of conium mac. In calcarea phos, we have pain in mammary, sore and burning, nipples aching, sore during pregnancy. Now, here you can see that how easily we can differentiate medicine just based on the type of the pain. Here you can see in sepia, while there is shooting type of pain, in conium we have neuralgic pain. In calcarea phos, there will be burning, sore and burning. So here this is easy. What kind of, that's why we usually ask patient now what kind of pain they are experiencing. की रोकम व्यथा होचे और की रोकम होचे, तो जब ये बोलते हैं और उसके बाद पेशेंट थोड़ा बहुत बोलता है, एग्जैक्ट पेशेंट इज नॉट एबल टू डिस्क्राइब, बट अगर पेशेंट बताता है तो डेफिनेटली दैट गिव्स अस हिंट कि मेडिसिन क्या हम सेलेक्ट कर सकते हैं. In bryonia alba, we have lumps in the breast, induration and inflammation of the mammary with diminished or retarded secretion of milk. This we can use in postnatal period as well, bryonia. Another important and most important, I think each and every pregnant female must have experienced this, and that is constipation. And we all know the reason for this constipation, for this complaint. So this is the most common one. In the nerve repertory and Murphy repertory together, if we see, there are common rubrics given as pregnancy, constipation during. Okay, so we have a lot of medicine like alumina, cholinsonia, okay, dolichos, nux vomica, platina, sepia. Bowels alternating with loose. Okay, if there is alternate diarrhea and constipation, okay, diascoria is the medicine, and crumbling stool is ammonium mure. Difficult stool is nux mocheta. Feces, if there are hard feces, veratrum is the medicine. If she's experiencing constipation as well as morning sickness, you can think of cholinsonia. Manual assistance must be rendered. Alumina is sepia, but sepia is given in high grade. Night after watching and mental disturbance. Okay, if there is any sort of mental disturbance or she was not able to sleep properly, and then if she is experiencing this constipation, we can think of pulsatilla. What are medicines we can think of? So, torpor of rectum, even soft stool requires great straining. Passes stool better standing. Chilliness during and after stool. So this is another important. As we all know, alumina is one of the important medicine for constipation, for all sort of constipation. So definitely it is useful during pregnancy as well. But if the patient says that during and after stool, ठंडी लगती है, okay, if she is having this chilliness after and before and after stool or during and after stool, then you should be sure that the medicine is alumina. And the patient is able to pass stool better by standing. On the other hand, in dolichos, we have constipation with intense eating, bloated abdomen and white stool. So if patient is saying that बहुत constipation मतलब stool hard, stool सही से हो नहीं रही है pass, and also there is anal itching. So अगर ये complaint है तो you can think of dolichos. In cholinsonia we have constipation, congestive inertia of the bowel, sensation as if sand in rectum, and bowels move more in evening. So morning में constipation रहेगा patient को, but evening में stool pass होती है. So evening में better होगा और morning में constipated रहेगा. So that is your cholinsonia. In natrum mu, we have perspiration at the slightest movement, difficult expulsion of the feces, heaviness through the pelvis and across the abdomen. So यहाँ पर there will be inactivity of rectum and there will be perspiration. थोड़ी भी movement करने से patient will have profuse perspiration. So that is natrum mu. Now, frequent urination. This is also another important physiological reason. We know why a patient will experience this. क्योंकि जैसे ही uterus का size बड़ा होगा, the bladder will have not that much space, and that is where frequent urination will occur. अब यहाँ पर क्या क्या rubrics है? In nerve repertory, though there are many other repertories also, but these are the main repertories जहाँ पर special chapter दिया है dedicated to pregnancy. और बहुत सारे rubrics है. That's why I have included rubrics from nerve, complete, Murphy and Borik's repertory. So for this, in frequent urination, we have in nerve repertory. Urination difficult. So we have a lot of medicine like aconite, cantharis, equisetum, lyco and all. But if the urine skip involuntarily, okay, involuntary अगर urine होता है तो natrum mu. Too quick skip of the urine is sepia. And अगर frequent and copious urine हो रहा है तो lilium thick is the medicine. In boric, we have bladder disturbances, tenesmus, belladonna, cantharis, causticum are the medicine. Frequent desire, अगर बार बार desire हो रहा है, ठीक है? अब now see, here is a little difference. अगर frequent urination होना और frequent desire होना, there are two, यहीं पर उसके नीचे you can see another rubric is frequent. First is frequent desire and another one is frequent urging. अब दोनों में ये क्या है डिफरेंस कि मतलब बार बार जाने, ऐसा लग रहा है कि अभी जाना है, यूरिन पास होगा, ठीक है, बट नॉट नेसेसरी कि यूरिन होगा ही, ठीक है। और एक ऐसा होगा जहाँ पे पेशेंट विल फील कि हाँ यूरिन जाना है, बाथरूम जाना है, एंड वहां जाने के बाद यूरिन पास भी पेशेंट करेगा. सो देयर इज टू डिफरेंस. ओके, हैविंग ओनली अर्जिंग और डिजायर, हैविंग ओनली डिजायर एंड हैविंग अर्जिंग. ओके, सो ये दोनों को डिफरेंशिएट करके कंफर्म करके एंड देन वी कैन प्रिस्क्राइब. इफ देयर इज ओनली डिजायर, ओके, सो कोक्यूलस, और अर्जिंग अगर है सो नक्सोमिक. Now must rise between 12 and 3 a.m. Aconite is the medicine. Constant urging and pressure with tension in abdomen, pulsatilla is the medicine. Urging भी है, pressure भी feel हो रहा है, और साथ ही साथ जो है abdomen में भी tension feel हो रहा है. Then you can think of the medicine pulsatilla. Now medicines. Here we have equisetum. As we all know, the theraps of frequent urination is equisetum, sarsaparilla, cantharis, and all. So, what are the keynotes? Differentiating features क्या क्या होगा इसमें? So, in equisetum we have severe dull pain in bladder as from distension, which is not better by urination. And you can use this medicine other time also. बहुत बार ऐसे होता है कि here to we are describing it in relation with pregnancy, but otherwise also many times this happens that if we are out somewhere and we there is some urgency कि जाना है अभी washroom, but due to circumstances या आप traveling कर रहे हो, whatever the reason, and you are not able to pass urine at that point of time. आप घर आओगे, उसके बाद you can use washroom, you can go to washroom, and but even after that, even after passing urine, there is a slight sensation, a different type of feeling, okay, or a distension is felt in the abdomen, and it is you feel like अभी फिर से वापस से यूरिन पास करना है, बट यूरिन नहीं होता है, एंड दैट सॉर्ट ऑफ फीलिंग एंड दैट डिस्टेंशन इन एब्डोमेन, अगर जब भी ये होता है तो इक्विसिटम इज द मेडिसिन. Now pain at close of urination with increased appetite. Okay, so last जब यूरिन खत्म पास हो रहा है और उसके लास्ट में जब यहाँ पर अगर पेन हो रहा है, and also patient complains or says that there is increased appetites. Okay, so you can think of medicine equisetum. In cantharis we have, as we all know, burning will be there, urging, constant urging to urinate before, during, and after urination, and there is pain in suprapubic region, worse after drinking water, and also patient will have burning sensation. In sarsaparilla also we will have close of urination. So here you can see in equisetum also close of urination, and in sarsaparilla also close of urination, और cantharis में before, during, after सब time पर होगा this pain also and urging also. But in sarsaparilla you will have that urine will rebels while sitting and passes better while standing. ये difference रहेगा. In creositum there is burning pain during and after urination. Diminished urine although drinks much. Urine कम होता है and can urinate only when lying. So here are some difference. You can see that passes better by standing, passes better by lying. So yeah. Oh, this is one of the important complaint during pregnancy. Otherwise also in females this is most common complaint, and that is mood swing, which we can see in males also these days. So what all rubrics we have? We have inner repertory, has no affection for anybody. Aconite. Now here you can see why I have taken this rubrics. So mood swings can be anything, like okay, she can be extreme happy or extremely sad, she can be irritable at the moment, okay, she will have anxiety, and a lot of mixture of all different emotions will be there. So you can take up any rubrics given in mind section also. बट यहाँ पर रिलेटेड टू प्रेगनेंसी अलग से दिया हुआ है, सो वी विल टेक दैट इफ द पेशेंट हैज नो अफेक्शन फॉर एनीबडी ड्यूरिंग प्रेगनेंसी, अगर ऐसा लग रहा है कि शी वाज वेरी लविंग केयरिंग, और अभी ऐसा ड्यूरिंग प्रेगनेंसी नो द फैमिली मेंबर्स विल से ऐसा लग रहा है कि इसको किसी से कोई लेना देना ही नहीं है, शी इज ऑल लाइक शी डोंट केयर फॉर अस एनीमोर, so has no affection for anybody. Suddenly if people experiencing that, aconite is the medicine. If there is apprehension, lycinum. If derangement, emotions की derangement मतलब समझ नहीं आ रहा है, that is only mood swing. So if there is derangement emotion, belladonna is the medicine. Words from fright and anger also, nux mochita is the medicine. Haughty, veratrum album. Full of strange ideas, stramonium. Irritability, chamomilla. Mania is stramonium. Suicidal melancholy is aurum. Strange notions, lycinum. Taciturn is Viratram album. Wants to wonder about home is Viratram album again. And tendency to weep. Here, do not jump to pulsatilla every time, okay, or sepia every time. Here you can see the medicine is macabre given for tendency to weep. In Murphy, we have pregnancy abandoned feeling. ये बहुत बहुत common है. Then each and every female will say that she will feel abandoned. Okay, ये बहुत female को ऐसे feel होता है, 4 second feel होता है कि उसकी अब उतनी care नहीं हो रही है, या whatever like this. So अगर ये complaint है या ये feeling है, so can think of pulsatilla. Okay, then we have, okay, why this is not coming? Okay, depression is natrum mute and sepia also, and fear of death is aconite. In pulsatilla, the patient, as we saw, there will be fear, this feeling of abandonment. So fear to be alone, darkness, and ghost, and there will be craving for sympathy. This is the hallmark or keynote of pulsatilla. And she feels 4 seconds. So whenever patient complains that she is feeling 4 seconds, you can think of pulsatilla. अब ignatia में और इसमें difference कैसे करोगे आप? That ignatia will have more of changeable mood. Although changeability is one of the important symptom of pulsatilla, but ignatia में you will see that changeable mood and sudden outbursts, hysterical जो हम जानते हैं, but she will have a childish behavior over here. In Nux Mojita, we have changeable mood, one moment laughing, the next crying, and complaints accompanied by drowsiness and sleepiness, and the patient will be absent-minded. In Simisifuga, we have fears, riding in carriage, obliged to jump out, tries to injure herself, great depression with dreams of impending evil. अब ये कैसे डिस्क्राइब करेगी पेशेंट कि she will feel that कुछ होगा, like you know my pregnancy will not be fruitful, या हो सकता है मेरे बेबी को कुछ हो जाएगा, या she will feel like husband late आया है तो हो सकता है husband का accident हो गया, and whatever sort of. So there is great depression with dreams of impending evil. These dreams will create a fear, okay, and she will try to injure herself in that also. In aconite, we have elements, as we all know, elements from fright, great worry, intense fear, anxiety over trivial elements, fear of death or of the future. So these are all medicines you can think of for mood swings during pregnancy. Now, another important, when she have abnormal cravings. Abnormal craving is lycinum, given in repertory. Strange craving is, मतलब आप सोचोगे ये कैसे खा सकती है patient? This is very strange. This is very weird. Okay, abnormal is fine. Strange is lycinum again. For unusual articles of food, chelidonium is the medicine. In boric, we have alumina and sepia given for abnormal craving. In Murphy, we have food, general desire, acids for food for certain kinds of. मतलब ऐसा होगा, Macca and pulse is the medicine given. So it will be like the patient will start liking a certain kind of food article, food product. कि अब सिर्फ यही खाने का मन हो रहा है. Usually we know that सार desire for होता है, चार खाने का मन हो रहा है, ये एक पर्टिकुलर अगर फूड आइटम बार बार खाने का मन अगर कर रहा है, ऐसा पेशेंट डिस्क्राइब जब करता है, सो मैक्काब एंड पल्सटिला इज द मेडिसिन. In calcaria, she can have egg, craving for egg, indigestible thing, as we all know, like chalk, charcoal, coal, and pencils. In natramure, there will be desire for acids and longing for bitter food and drink. And in nux vomica, there will be craving for pungent food, charcoal, chalk, stimulant, milk, and tonics. In pulsatilla, taste of food will remain for a long time in the mouth, and food, especially bread, will taste bitter. है ना? Bitter यहाँ पर bread जब भी हो, you can consider it roti also. In Silesia, we have craving for lime, sand, and raw food. Okay. And raw food, we usually think of alumina, but Silesia is also one of the important medicine. In alumina, however, we have craving for starch, chalk, charcoal, cloves. Okay. Then coffee, tea ground, acid, raw rice and indigestible things. अब यहाँ पर अगर raw कोई भी food अगर खाने का मन कर रहा है तो साइलिशिया होगा, लेकिन raw rice अगर particularly mention कर रहा है patient, so we can think of alumina. In sepia, no, everything will taste too salty. So here is difference कि pulsatilla में the taste will be bitter. हर चीज या स्पेसिफिकली अगर रोटी पेशेंट खा रही है, ब्रेड जो खा रही है, वो बीटर टेस्ट करेगी. सीपिया में क्या होगा कि सॉल्टी टेस्ट करेगी. ठीक है. और नैट्रम म्यूर में बीटर का डिजायर होगा. ठीक है. तो इस तरह से यू कैन डिफरेंशिएट. और नक्सोमिका में पंजेंट फूड का डिजायर होगा. Then, so that was about first trimester. अब second trimester में आते आते क्या होगा? There will be melasma, there will be pedal edema, and definitely there is going to be backache. How we can help here? For melasma, what we can do? So melasma में you can see very few rubrics are given, but we have. What I want to show here is the aim of whole of this presentation is that we have lot of rubrics, beautiful rubrics given in our repertory. All we need to do is go and look for that particular rubric. So बहुत अच्छे and related to each and every complaint, each and every disease condition, we have rubrics given in our literature. So for melasma, we have, it is also known as quelasma. Okay. So quelasma is lyco and sepia. Sepia is one of the important medicine जो हम लोग usually करते हैं prescribe. In boric, we have rubric like face appearance condition, brown spots on, again sepia is the medicine. And nerve repertory में we have face earthy, macabre, and yellow brown spot is sepia. So melasma में sepia works really wonderful. And in lycopodium, you have this symptom, grayish yellow color of face with blue circles around eyes, withered, shriveled, and emaciated, copper colored eruptions. In sepia, we have around the mouth and nose, okay, and lentigo in a young woman. The most important, हो सकता है melasma के लिए patient ना भी आए, pregnancy के बाद usually आएगी patient, pregnancy के time usually नहीं seek करेगी help, but backache के लिए definitely patient can come, and there that is the most important thing, क्योंकि melasma अगर ठीक हो उस time या ना हो इतना ज्यादा फर्क नहीं होगा, लेकिन अगर patient को backache है, so then that is more important complaint we should address first. So इसको और अच्छे से समझना ज्यादा important है. So what we have in Murphy repertory, we have rubrics like back pain during. In pregnancy chapter only, we have back pain during Aeschylus and Kelly carb, aching lycinum, burning lumbar during pregnancy is Rustox, drawing in up. Now here you can see कि medicine differentiate कैसे हो रही है. हर एक rubric में आप सिर्फ ये देखोगे कि there is a difference of sensation. सिर्फ जो पेन हो रहा है, पेशेंट जो पेन एक्सपीरियंस कर रहा है, या तो आप उस बेसिस पे डिफरेंशिएट करोगे मेडिसिन, अदरवाइज द लोकेशन, एंड यूजुअली इट इज लो बैक पेन ओनली. सो लंबार रीजन में ही पेन मोस्टली patient complain karega. So you have to differentiate it on the basis of the sensation which patient is describing, the type of pain the patient is describing. So here you can see that aching अगर हो रही है तो लाइसिनम है, बर्निंग काइंड ऑफ पेन अगर है तो रस्टॉक्स है, ड्रॉइंग है अगर सैक्रल रीजन में ड्रॉइंग टाइप ऑफ पेन है तो सरसपरीला यू कैन थिंक ऑफ, And if there is shooting after diarrhea with colic, you can think of calcaria arsenicum. Then in nerve we have, if only there is pain, argentum nitricum. Sacral region में अगर pain है तो xanthosylum. Severe pain in sacral region before and during stool. Now this time modality is also important कि कब हो रहा है pain. So अगर stool के time ही patient experience कर रहा है backache, okay, if it is before or during stool, sarsaparilla we can think of. In boric we have backache. The medicines are Aesculus and Calica. From lying down, लेटने के बाद pain अगर हो रहा है तो Burbis vulgaris. When rising from seat, causticum and lachesis. And that is where this thing comes. जहाँ पे you have to know the location, sensation, modality, also the concomitant. जब ये अगर पता चलता है तो कोई भी medicine किसी भी disease condition के लिए हम लोग easily prescribe कर सकते हैं. So what all medicines we have? We have Aesculus. कैसे क्या है symptom? Backache affecting sacrum and hips. Worse while walking or stooping. अब यहाँ पर क्या है कि modality पे आपको ध्यान देना है कि अगर patient जब चल रहा है या when patient is stooping and that time pain is occurring, or if backache is associated with blind piles, तो ये हमें पता है Aesculus में piles and backache combined रहेगा. So that is your Aesculus. Calicab में क्या होगा? Calicab में there will be history of backache after abortion or during labor. Calicab I would say that अगर pregnancy के बाद, especially अगर if female had this cesarean section, वहाँ पर अगर उसके बाद patient complain करती है backache की, तो वहाँ और अच्छा काम करती है Calicab, also hypericum. So, Calicab में you have history of backache after abortion during labor. Violent backache which is better by pressure. In Rustox we have violent pain as if broken, pain and sprain which is better by motion and walking. So, यहाँ पर आपने देखा Aesculus में we have worse while walking and in Rustox we will have better by walking. So, here the modalities को differentiate करके then we can prescribe. In Barbaris, we have soreness with sharp pain following course of circumflex iliac nerve to bladder with frequent urination. So, अब patient अगर आके complain दोनों चीज की कर रही है, जो हमने देखा कि frequent urination first trimester में था, तो तब से start हुआ, पहले frequent urination हो रहा था and now it has led to backache also. You can think of Barbaris vulgaris. In sarsaparilla, however, we have sacral region में pain होगा, कहाँ होगा? It will radiate to the feet. Okay, नीचे तक pain जाएगा and it will be associated with the urinary complaint. That is sarsaparilla. So here you can see we have location, we have sensation, we have modality, also concomitant associated with urinary complaint, associated with frequent urination. So yeah. Then इसके लिए patient कितनी help लेगा we don't know, but we have, if some of our relatives, if we know someone and if we see that या फिर patient किसी और complaint के लिए आई है and then if you see that patient is also having pedal edema. So yeah, firstly we should make sure to know why this is occurring, BP and all things to be checked first and then we can prescribe medicine. So we have rubric in Murphy Repertory. Swelling, back of feet is bryonia. Merc, bryonia is high grade, also have merc, pulsatilla thuja. Swelling अगर heels के ऊपर है तो lycopodium, अगर toes पे है तो graphitis. Now again location के हिसाब से medicine सारी change हो गई. Toes पे graphitis आएगा, heels के ऊपर lycopodium, back of feet है तो bryonia. अगर in nerve repertory we have feet swollen, but along with it we have heartburn and varicose vein. Now here comes a concomitant with heartburn and varicose vein. Zincum is the medicine. अगर leg में cramps हो रहा है और साथ ही swelling अगर है, ठीक है, swelling of veins of ankles, lycopodium is the medicine. Now, how to differentiate them? In apis, you can see there is pedal edema. But क्यों हो रहा है pedal edema? Because of pelvic congestion or postural problem during pregnancy. अगर posture patient का सही नहीं है ना, ठीक से बैठ नहीं रही है, बहुत लंबा खड़े रह रही है, whatever is happening, and that is leading to this swelling. The apis mellifica you can think of. Limbs are immovable, heavy and numb. In arsenicum, you will have swelling of fit and lower extremity with waxy and transparent skin and characteristic thirst and vomiting also. In colchicum, we have edematous swelling and coldness of leg and feet and difficult to lift the feet. अब यहाँ पर देखो, apis में we saw the feet will be, the leg limbs will be heavy and numb. Okay. In arsenicum, we will have this transparent skin और साथ ही ये, ठीक है. In colchicum, the feet will be difficult to lift and साथ में क्या रहेगा, there will be coldness of legs. In digitalis, nocturnal swelling, सिर्फ रात में ही swelling होगी, दिन में पेशेंट को swelling फील नहीं होती है, दिखाई नहीं देगी. Coldness भी रहेगा hands and feet का. In zincum metallicum, edema of the feet and leg associated with heartburn and sensitiveness of sides of feet. So yeah, this is how we can differentiate medicines. These are few ऐसे और भी medicines को we can do. Now coming to our third trimester, the common complaints are hemorrhoids, varicose veins, heartburn, and insomnia. Hemorrhoids में what we have in repertory, we have hemorrhoids. The medicine are hemamelis, taxomica, sepia. अगर first month में था ना hemorrhoids अगर होता तो lachesis is the medicine. बोरिक में दिया है कॉलिनसोनिया, पोडोफाइलम एंड सल्फर. इसके लिए मेडिसिन द कॉमन वन वी ऑल नो हेमोराइड्स के लिए क्या रहेगी, नक्सोमिका. क्या रहेगा, नॉन ब्लीडिंग पाइप्स रहेगा, पेनफुल रहेगा एंड देयर विल बी इनफेक्चुअल अर्जिंग फॉर स्टूल. Eating in the piles, better by sitting in a tub of cold water. Again, the differentiating feature is that the patient will feel better by sitting in cold water and there will be itching. In colinsonia, we will have sensation of constriction and sharp sticks in rectum. Piles alternate with respiratory, heart or rheumatic symptoms. So rheumatic symptom anything. अगर knee pain में patient बोल रहा है कि हो रहा है ना, arthritic pain अगर हो रहा है, ठीक है. So you can think of colinsonia in that also. In sepia, bleeding रहेगा, ठीक है. Noxomica में we saw that will be non-bleeding piles. Sepia में, however, there will be bleeding at stool and fullness of rectum. Great tenesmus, pain shoot upward, which we know. Aggravation while standing, hemorrhoids prolapse and bleed on walking. In hemamelis also there will be bleeding, profuse bleeding रहेगी with soreness and anus will also feel sore and raw. A varicose के लिए we have rubrics like varicose vein. During pregnancy, the medicine given in Murphy, Ferromet, hemamelis and pulsatilla. Varicose with cramping pain at night, preventing sleep. अगर रात में पेन हो रहा है बहुत ज्यादा जिसकी वजह से पेशेंट सो नहीं पा रही है ठीक से, hemamelis is the medicine you can think of. अब now varicose veins attributable to high leaving, यहाँ पर नक्सोमिका medicine आएगी. In boric we have so many medicine given, arnica, then hemamelis तो common ही है, sulfur है. In nerve we have swelling of vein of ankle is lycopodium. Cannot walk, muscles will not obey, we all know delcinium, and if there is weariness, calcarea fos. What all medicines we have for varicose vein? We have ferromet, as we say, varicose vein inside of right thigh and then to left. तो start कहाँ से होगा varicose vein? Right से start होके left की तरफ अगर जा रहे हैं. एंड नमनेस है, वायलेंट पेन थाई में हो रहा है जो रात में ज्यादा हो रहा है एंड ड्यूरिंग रेस्ट स्पेशली व्हाइल सिटिंग स्टिल. बट जो कॉमन मोडालिटी है फेरम की, वी ऑल नो वॉकिंग स्लोली विल रिलीव द पेन. सो या वी हैव दिस. In pulsatilla we have varicose veins in leg worse from letting the affected limb hang down. अब here you can see in ferrum we have what, कि अगर पेशेंट बैठा है, रेस्ट कर रहा है, तो पेशेंट का पेन बढ़ जा रहा है ना. अगर वो स्लोली वॉक करेगा तो बेटर फील हो रहा है. ऑन द अदर हैंड पल्सटिला में क्या हम देखेंगे कि हैंग डाउन जैसे ही वो कर रही है पेशेंट लिम्स, तो क्या होगा, पेन बढ़ जाता है. पेन विल बी बेटर बाय स्लो जेंटल मोशन इन ओपन एयर. ओके, जो कॉमन मोडालिटी है पल्सटिला की. Then in hemamelis we have hard and knotty, swollen and painful veins, bruised soreness in femoral vessel in मिडल ऑफ नाइट। अब ये सबसे कॉमन कंप्लेन है डिस्पेप्सिया। ओके, एसिडिटी बार बार होगी पेशेंट को, और अगर प्रेगनेंसी के टाइम पे होती है तो ये और ज्यादा वर्स हो जाती है। सो मर्फी में वी कैन हेल्प द पेशेंट बाय यूजिंग रूब्रिक्स लाइक हार्ट बर्न। तो यहाँ पर है एपिस, कैप्सिकम, कार्बोवेज। अगर हार्ट बर्न नाइट पे हो रहा है while going to bed, ओके, पूरा दिन पेशेंट अच्छी है, रात होते ही क्या होगा, जैसे सोने जाएंगे तुरंत शी विल हैव दिस फीलिंग ऑफ हार्ट बर्न। ओके, एसिडिटी बहुत ज्यादा स्टार्ट हो जाती है, तो यू कैन थिंक ऑफ द मेडिसिन कोनियम मैक। अगर पैल्पिटेशन भी है और हार्ट बर्न हो रहा है तो नेट्रम्यूल वी कैन थिंक ऑफ। अगर patient is having this acidity, all this heartburn wala symptom, and along with it, if there is also pedal edema or swollen feet, then zincum is the medicine. Agar stomach during it is sapadilla and bilious complaint is naxomica. Heartburn तो हो रहा है, ठीक है, acid dyspepsia है, and also there is bilious complaint, other bilious complaint, then naxomica you can think of. एम्प्टीनेस सेंसेशन ऑफ अगर फील होता है तो सीपिया। अगर ऑन द अदर हैंड फुलनेस का सेंसेशन फील होता है तो नक्स मॉर्जेटा। सो दिस इज वेरी इंटरेस्टिंग इन अवर होम्योपैथी that we have medicine for each and every complaint of the patient, and a very small feature will help to distinguish the medicine. So yeah, individualization हम कितना deep level पे जाकर कर सकते हैं. So we can see अगर if patient is saying खाली खाली सा लग रहा है, ठीक है, empty sensation हो रहा है, you can think of sepia. अगर patient is saying कि भरा भरा सा लग रहा है ना, fullness वाला sensation feel हो रहा है, so then next मौजूदा तुरंत मेडिसिन चेंज हो जाएगी. अगर स्वीटिश बल्जिंग हो रही है तो जिंकम. अगर वाटर accumulation of acrid with cramps, then जिंकम is the medicine. अगर बर्निंग हो रही है तो डायस्कोरिया. burst as if it would with wing. ओके, इतना ज्यादा पेट फूल गया, ऐसा लग रहा है कि अभी पेट इतना ज्यादा गैस हो गया है कि पेट फट जाएगा, ऐसा फील हो रहा है. अर्जेंटम नाइट्रिकम इज द मेडिसिन. If patient can lie comfortably only on in early months, okay, then podophyllum. Dyspepsia, flatulent, what is? Okay, we can't edit here, na? That's why यहाँ नीचे दिख नहीं रहा है last. Okay, anyways. Okay, so medicines we have in pulsatilla, we have gastric complaints from eating oily, rich, fatty food, cake, pastry. Okay, ये सारी चीजों की वजह से अगर हो रहा है acidity, तो pulsatilla get great tightness after a meal, must loosen clothing. Taste of food remain long after. Okay, so that is pulsatilla. In natramule में फैट और मिल्क, तो ये भी इंपॉर्टेंट है. अगर पेशेंट सपोज आकर हमें बोल रही है एक्यूट कंप्लेन के लिए, पेशेंट इफ कमिंग एंड कंप्लेनिंग दैट एसिडिटी हो रही है, हार्ट बर्न हो रहा है, बहुत ज्यादा जलन हो रही है, यू नो इरिटेशंस हो रहा है एंड ऑल दिस. सो फर्स्ट थिंग व्हाट वी इंक्वायर इज कि कल रात क्या खाया था, है ना, या फिर लास्ट क्या खाया था, खाने में क्या खाया था. So here also why this symptom will guide us to medicine, क्योंकि अगर क्या खाने के बाद में हुई है start complaint, so that is also important कि अगर oily rich fatty कुछ खाया उसके बाद start हुई तो will go to pulsatilla. अगर fat या milk की वजह से हुआ है तो natrum phos. Okay, irritations after eating, yellow coating of at the back of the tongue. कैप्सिकम में क्या होगा, देयर विल बी अटोनिक डिस्पेप्शन, हाइपर एसिडिटी, बर्निंग और ट्रेमलिंग एंड आइसी कोल्डनेस इन द स्टमक, क्रेव्स कॉफी बट इट नॉशिएट्स. मैकाब में क्या होगा, देयर विल बी सार टेस्ट, सार इरिटेशन, एवरीथिंग विल बी सार, एंड देयर विल बी ड्राइनेस ऑफ माउथ और बिटर वाटर की वॉमिटिंग होगी. नक्सोमिका में क्या होगा, कॉफी के बाद, अल्कोहल या बहुत ज्यादा स्पाइसी खाने के बाद, हाईली सीजन फूड, या नहीं सोए है पेशेंट कि खाना वगैरह तो सब कुछ सही था लेकिन कल रात नींद अच्छे से नहीं हुई है और उसके बाद आज मॉर्निंग में एसिडिटी फील हो रही है, then we can think of Nexomica. So there will be sour and bitter irritations, wants to vomit, but patient cannot. So there is a beautiful symptom given na कि patient will feel better only if I can vomit, I can feel better. That is a symptom, and that is Nexomica. यहाँ पर अब आ जाते हैं insomnia. This is the most troublesome complaint for each and everyone. और अगर प्रेगनेंसी की टाइम हो रही है तो और ज्यादा ट्रबलसम होती होगी. So we have rubric like insomnia, sleepless, belladonna, carcinosin, semifuga, coffea, क्रैम्प्स इन काफ फॉर्म, मतलब नींद नहीं आ रही है लेकिन उसका रीजन है क्या कि क्रैम्प्स है, पैर में बहुत ज्यादा क्रैम्प्स आ रहे हैं और उसकी वजह से नींद नहीं आ रही है. सो वी कैन थिंक ऑफ मेडिसिन लाइक केलकेरिया, क्यूप्रम, ओके, मैकफॉस, विरेट्रमल्बम. नर्व में भी हैव ओनली वन रूब्रिक, ड्राउजी, गेट अनेबल टू स्लीप, मतलब अभी ऐसा लग रहा है कि बहुत जल्दी नींद आ जाएगी, बहुत जल्दी सो जाऊंगी, बहुत ज्यादा यॉर्निंग भी हो रही है, सब कुछ है, ड्राउजी भी फील हो रहा है लेकिन नींद ही नहीं आ रही जब लेट जाओ तो. नक्स मोचिटा इज द मेडिसिन. In boric, we have sleeplessness, only given medicine. So we have coffea, nux vomica, pulsatilla, and sulfur also. So here we need to differentiate that. How to do that? In carbo-veg, we'll have अलग अलग रीजन रहेगा ना, सबको एक ही रीजन से तो नहीं होगा कि आज नींद नहीं आ रही है ना, सबका रीजन अलग अलग हो सकता है. तो इफ द पेशेंट कंप्लेन्स दैट जैसे ही सोने जाएगा रेस्पिरेशन में कोई डिफिकल्टी हो रही है, सो रेस्पिरेशन स्टॉप एंटायरली ऑन फॉलिंग अस्लीप, तो उसकी वजह से क्या होगा, देयर विल बी इंसोम्निया. देन अगर नींद आएगी तो बहुत ज्यादा ड्रीम्स आ रहे हैं, सो फुल ऑफ ड्रीम्स और ग्रेट अनइजीनेस ऑफ बॉडी, अवेकन ऑफ्टन आफ्टर मिडनाइट फ्रॉम कोल्ड लिम्स, और लिम्स कोल्ड हो गया उसकी वजह से बीच में नींद खुल गई. सो देयर कैन बी मेनी रीजंस एंड हियर यू कैन थिंक ऑफ मेडिसिन कार्बोवेज. In pulsatilla, what will be the reason? The patient will be sleepless after last supper or eating too much. बहुत ज्यादा खा लिया ना उसकी वजह से अब नींद नहीं आ रही है. So that is different reason. Sleeps late in morning, wide awake in evening. Sound sleep when it is time to get up. मतलब देर से नींद आएगी, रात में नींद नहीं आई, सुबह सुबह नींद लगी and now she is unable to wake up. Okay, so that is pulsatilla. Lycopodium में क्या होगा? Patient will be sleepy during day and wakeful at night. Mind will be too active, sleep will be restless. Now अगर बहुत देखो रीजन अलग अलग हो रहा है, किसी के कोल्ड डिप हो गया है तो नींद नहीं आएगी, यू कैन थिंक ऑफ कार्बोवेज. किसी ने बहुत ज्यादा खा लिया, अगर उसकी वजह से नींद नहीं आ रही, पल्सटिला. किसी का माइंड बहुत एक्टिव है, कंटिन्यूली कुछ सोच रहे हैं एंड जब नींद नहीं आ रही है तो लाइकोपोडियम. ओके, या फिर स्लीपलेस फर्स्ट पार्ट ऑफ द नाइट फ्रॉम फ्लैचुलेंस एंड फंक्शनल palpitation, that is also lycopodium. In colchicum, we have debility following loss of sleep, awakes unrefreshed and tired in the morning with loss of appetite. Insomnia, as she cannot lie on left side on which she is accustomed. अब this is also another trouble कि the patient is accustomed to sleep on left side. हमेशा जब लेफ्ट में सोएगी तभी उसको बहुत अच्छे से नींद आती है. But now during pregnancy she is unable to lie on left side और इसकी वजह से now she is feeling sleepless और insomnia हो रहा है. So here the medicine is colchicum. In elapsed coral, we have sleeplessness from lancinating headache. Patient को एक headache हो रहा है और उसकी वजह से नींद नहीं आ रही है. So elapsed coral is the medicine. Dreams of dead persons, of business, बहुत ज़्यादा dreams आ रहे हैं जो disturb कर रहे हैं sleep को. So that is. So here you can see that only that is the reason we can't prescribe based on the diagnosis of the disease, on the name of the disease. सिर्फ इंसोम्निया कोई बोल रहा है और आप मेडिसिन प्रिस्क्राइब करने का सोच रहे हो, ऐसा हम नहीं कर सकते. We cannot do that because we have a lot of medicine and each medicine will differ according to the cause. So yeah, that is about. So we have completed with all the 3 trimester and complaints which patient can have. Now let's see how we can help during labor. Now this is something अगर कोई बहुत ज़्यादा hospital से attach है या you know if you have your own relative जहाँ पे आप help कर सकते हो, because usually you know during labor doing a prescription I don't think so practical है. Definitely इसका result बहुत अच्छा आएगा if we can. अगर कर सकते हैं तो definitely इसका बहुत अच्छा I think we all should at least try once. So let's see what we can do. अगर labor के time पे whatever patient is complaining, let's see. If the patient is having abdomen sense of weight, it is CPR. If she wishes to be fan and wants air, ये मैंने I have seen this when I was you know during internship, not during internship, before that also a patient she was in labor and she was not ready to lie down. She was saying इतनी ठंड में भी she wanted a fan continuously. She wanted कि पूरे दरवाजे भी खुले रहे, फैन भी चलता रहे और उसको और ऊपर से ऐसे हाथ से भी अपने पेपर से she was trying to get that air. And that time I didn't know about this rubric. But here you can see, wishes to be fanned, wants air. The remedy is sulfur. Shivers in first says, simisifuga. Cold. Abhi labor mein what we all do, we can do is observe. Okay, observe the patient, what patient is doing. Okay, or how she is feeling. Okay, तो वहाँ उसी basis पे ये rubric सारे दिए गए हैं और हम medicine prescribe कर सकते हैं. So if patient, we can see that patient is shivering in the first stage, you can think of simisifuga. If there is coldness of skin, camphor is the medicine. If she's fainting, starting to fainting, sickle core is the medicine. If labor pain absent, but O's are dilated and membranes are protruding, you can think of gelsemia. If labor pain ceases nearly or entirely, suddenly, मतलब अभी तक labor ठीक जा रहा था and suddenly pain has gone, so Naxvomica is the medicine. If child seems to ascend with every pain, okay, instead of descending, the baby is ascending. So you can think of alcemia. Labor pain बहुत ज़्यादा हो रहा है, excessive labor pain. Okay, sickle core is the medicine. If labor pain is exhausting the patient, colophyllum and veratrum, we can think of. If tendency to faint, Naxvomica. Says she must and will get up. Patient don't want to lie down, उठ के बैठना है, ठीक है? Chamomilla is the medicine. Okay, premature labor हो रहा है तो sickle core है. Must keep in constant motion, walks the room whipping. Patient रो रही है, ठीक है? पूरे room में घूम रही है, she's whipping. Lycopodium. Must stand or walk about, wants back rub. Okay, and like to have room warm. Okay, अभी यहाँ हमने देखा wish to fan, तो sulfur. अगर warm चाहिए room, तो Naxvomica. अगर patient को उठना है या फिर उठ के रूम में घूमना है, शी इज आस्किंग द जो साथ में कि बैक रब करो. ओके, नक्सोमिका इज द मेडिसिन. अगर बहुत सारे यूरिनेशन पेशेंट को फ्रिक्वेंट यूरिनेशन लेबर के टाइम, कैमोमिला. लेबर पेन इनफेक्चुअल फ्रॉम डिफेक्टिव पोजीशन ऑफ चाइल्ड, एकोनाइट इज द मेडिसिन. सो ब्यूटीफुल रूब्रिक्स वी हैव. अगर हम यूज कर सके तो दैट विल बी सो हेल्पफुल इंस्टेड ऑफ टेकिंग द मेडिसिन विद सो मेनी साइड इफेक्ट्स. In this WA English report, we have this abdomen bloated is carb. Cramps agar ho rahe during labor, gelsemium is the medicine. Back pain cutting across lumbar region with carb is the medicine. If patient is saying bed is feeling very hard, you can think of belladonna. Agar hot feel ho raha hai, to opium. Covered will not be during. Okay, अगर patient is not taking the covering labor के time पे, camphor and sickle core is the medicine. You can think of it's not the medicine. You can think of this medicine. Then examination intolerant from local sensitiveness. This is also very important and peculiar symptom. You know, when the doctor or the this gynae is trying to examine the patient, she is not able to tolerate that examination. We can think of platina because of that sensitiveness. अगर nervousness है patient को, ठीक है, तो belladonna and gelsemium. And she will not permit the examination. ठीक है, nervousness की वजह से नहीं permit कर रही है. Here you can see this examination intolerant यहाँ continue है. अगर sensitiveness की वजह से नहीं examination करने देगी तो platina. Nervousness की वजह से if she is not giving, then belladonna and gelsemium. Will not permit and snappish agar patient hai, so then chamomilla. Now, if there is flatulency, lycopodium. If after labor, nux mojita, we can think. Hands touched cannot bear to have during. Agar patient ka haath pakadte hai, to she will not allow you to touch. Okay, that is China. Here you can see medicines like sepia. During labor, sepia agar hai patient, so she wants to be covered up more and she thinks she can endure the pain easier. Okay. Pain in the back and abdomen, she crosses her legs to relieve that. And viburnum, prunifolium में क्या होता है? There will be false pain. Very painful, cramp-like labor, like pain in the uterus. Pain so severe as to threaten to rupture the membrane and bring on इतना severe pain होता है as if the miscarriage हो जाएगा अभी, ठीक है? And false pain है ये, ठीक है? So that is your viburnum. Then in sickle core, we have hourglass contractions, a sensation of constant tonic pressure in the uterine region, prolonged bearing down and forcing pain, causing great distress. don't like to be covered. So sickle core may we saw that in CPI we saw patient want to be covered. In sickle core patient don't like to be covered. In natrum curve we have anguish, tremor, perspiration with every pain during which she desire to be gently rubbed, which affords her relief. Then almost done. I think last 2 slides. During purpurium. Okay. So yeah, postpartum hemorrhage है. Okay, we can all the complaint क्या क्या होती है? Postpartum hemorrhage, postpartum fever हो सकता है, psychosis, retained placenta, convulsions, trauma. For all this, we have medicine. I'm not discussing it over here, but yeah, we do have medicines for all this complaint as well, and we have rubrics as well. So for postpartum hemorrhage, you can think of all this medicine like belladonna, chamomilla, and all. अगर postpartum hemorrhage हो रहा है because of atony of blood vessel, you can think of Kenica. And if the blood is bright red and it is flowing steadily, it is hyoscyamus. अगर large clot होते हैं, ठीक है, crocus, then coffee ground offensive discharge है तो nitric acid. Constant, if their bleeding is constant every few minutes, a large clot of bright red blood with bearing down pain, Eustilago is the medicine. Continue bleeding हो रही है and obstinate, it is Nux mosquita. And if the bleeding starts some days after delivery, it is this. 8th day पे start अगर reappear हो रहा है blood तो Sabina is the medicine. Then following hard delivery, it is Medifolium. Hasty labor की वजह से हो रहा है तो Colophilum. Here we have Sabina में the slightest motion will increase the flow and walking about will diminish it. Okay, थोड़ा सा motion करने से बढ़ जाएगा, लेकिन fast walk कर रही है, ज़्यादा walk कर रही है तो कम होता है. And the यहाँ पे differentiate कैसे करना होगा on the basis of the color and the character of the blood. So if there is dark red flux with very dark clots in the thin watery blood, that is Sabina. In sickle core, however, we will have bleeding due to retained placenta. Okay, and there will be delirium and loquacity and uterine atony, especially after protracted labor. Discharge will be continuous, passive flow hoga, but profuse रहेगा, and it will be worse from motion. In colophilum, there will be uterine debility, profuse होगा, और ये क्यों होगा? Because of hasty labor. In Eustilago, we have slow and persistent oozing of dark blood with small black clots, dark semi-fluid but not watery blood. So here you can see on the basis of the discharge, okay, color, clots or character जो है bleeding का, on basis of that we can differentiate the medicines. Perineal trauma अगर हो जाता है तो we all know arnica will be a good medicine. Yeah. So here you have in repertory perineum ruptured, arnica and calendula. Soreness अगर सिर्फ है तो arnica. Arnica क्या करेगा? It will promote absorption of extravasated blood and also prevent suppuration and septic condition. और calendula क्या करेगा? It will promote healing after C-section. It will promote healthy granulation and rapid healing by first intention if applied locally. Arnica high in high potency will often entirely prevent after pains when administered at the close of labor. Okay, unless contraindicated, definitely. That has been bruising to the parts and straining to the general muscular system. It aids in restoring the parts to their natural condition. ठीक है, जैसे ही लेबर हो जाता है कंप्लीट, उसके बाद अगर हाइपोटेंसी में अर्निका देते हैं तो क्या होगा कि जल्दी इट विल हेल्प टू रीस्टोर द पार्ट्स टू देयर नेचुरल कंडीशन. देन फीवर अगर आ जा रहा है डिलीवरी के बाद पेशेंट को, वी हैव ऑल दिस मेडिसिन आर्सेनिकम बेलाडोना. अगर 4th डे पे आता है फीवर, सीवियर चिल है एंड देन फीवर स्टार्ट होता है तो फाइटोलुका इज द मेडिसिन. Particularly after violent emotion or suppression of milk, then belladonna is the medicine. If fever is brought on by indignation or grief because of unkind treatment, ऐसा बहुत बार होता है, ये बहुत सारी females experience करती होगी. Like if they were thinking of some particular gender और नहीं अगर होता है ना, after that if she is having all this indignation, grief और ये, या फिर अगर उसके इन लॉ से या कोई भी फैमिली मेंबर से अनकाइंड ट्रीटमेंट हो गई उस टाइम पर, दैट इज वेरी सेंसिटिव पीरियड. एंड आफ्टर इफ she is getting this fever, you can think of colosynth. 5th डे पे अगर होता है और इंटरमीडिएट है तो लाइकेसिस. सडन सप्रेशन अगर लोकिया का हो रहा है तो विरेट्रम विरिडे. एब्सेंस ऑफ मिल्क है तो कैमोमिला. पेरिटोनाइटिस इज ब्रायोनिया बेलेडोना कैलिका. पाइमिया इज अर्निका. फर्स्ट स्टेज में अगर है तो कैलीम्यू, सेकेंड में कैलीफॉस. In boric repertory, we have purpureal fever, that is septicemia, and we have all these medicines. And how we differentiate in belladonna, there will be no thirst, there will be cool extremities, there will be dry heat with chill and throbbing headache, and the fever will be worse at night. In veratrum viridae, we will have zigzag fever. There will be hyperthermia in evening and hypothermia in morning. मतलब morning में fever नहीं होगा, evening में fever rise हो जाएगा, and there will be delirium. In bryonia alba, we will have cold chilly sensation, which will predominate in fever. There will be much thirst or large quantity of water and sharp pain over eyes. Dry mouth, tongue coated, जो हमें पता है. In lachesis, we will have chill in back. Then fit will be icy cold, intermittent fever, trembling and confusion, in effect of suppressed discharges. Convulsions अगर in case patient को होता है, so we will have nerve repertory में we have this. अगर convulsion if patient is having, and if we came to know that it is after anger, think of chamomilla. If it begin when labor ceases, जैसे ही labor खत्म हुआ है उसके बाद convulsion patient को start हो रहा है, sickle core is the medicine. Conscious during paroxysm, okay, convulsion है but patient is conscious, then coculus. Loss of consciousness, patient conscious है तो एक medicine होगी, patient unconscious हो जाता है तो now the medicine will be stramonium. If it continue after birth of fetus, it is antidart. If eyes are open but they are immovable, then coculus. If knew everyone but her child during interval, convulsion है, आसपास के सब लोगों को पहचान रही है but अपने बच्चे को नहीं पहचान रही. If the female, dulcimium is the medicine you can think of. Then we have a touch of larynx reproduces spasm. Okay, convulsion में patient है, larynx पे थोड़ा सा भी touch अगर किसी ने bystander ने डॉक्टर ने कर दिया, and again फिर से क्या होगा, there will be spasm, that is cantharis. If there is with frothing at mouth followed by variable spasm during 8 month, okay, premature labor हुआ है और 8 month में ही अगर labor हो गया और वहां पर if patient is having this convulsion with frothing and all, sickle core you can think of. If convulsions are during sleep, coculus. If loss of speech or speech is stammering, then stammonium. If there is gnashing of teeth during convulsions, then you can think of causticum. If there is vomiting during convulsion, it is cuprum. Ab yingling mein we have this anxiety extreme before. Okay, this is the medicine given. I have never used it. Crocata. Okay, Onanthe crocata. If there is diarrhea with arsenicum, extremities, stiffness of macphos. If there is tingling, aconite. If there is trembling, an opium. If fingers are extended and then closed, lycopodium. Injures herself, tries to. If during convulsion, patient tries to injure herself, think of simisfuga. If jaw renewed by, okay, next, vomica is the medicine. Now here you can differentiate it like this. In cicuta, we will have strange contortion of upper part of the body and limbs during paroxysms, blue face, and followed by weakness and insensibility as if dead. In chininum sulf, we have intermittent pulse and albuminuria along with convulsion, tetanic convulsion with loss of consciousness. In atropium, we have after normal birth, violent convulsions, unconsciousness, gnashing of teeth, bloody foam before the mouth, bending of thumbs. In lysine, we have spasm or excited whenever she attempts to drink water. Okay, or even if she hears this sound of pouring from one vessel to another. अगर retain हो गया है placenta, तो nerve में we have rubrix, placenta retain, cantharis is the main medicine given. Now, what of action or spasmodic contraction, pulsatilla? Atony की वजह से हुआ है तो sabina, और साथ ही constant bearing down हो रहा है तो sickle core. if it is removed 18 hours after delivery, Kedicarb, मतलब बहुत टाइम बाद अगर वो रिमूव होता है तो Kedicarb you can think of, और उसके साथ अगर painful urination है तो Cantharis. You have medicine like Cantharis with teasing to urinate, burning, and almost constant desire. In colophylum, we will have spasmodic retention from exhaustion and weakness. And cocculus, we will have terrible pain in the small of back, lower limb feel paralyzed, frequent vomiting will be there along with retained placenta. In semicifuga, rheumatic subject, there is a distressing tearing pain in the uterine region. So, if there is toothache, you can think of all this medicine. Chamomilla, lysine, sepia, okay. So, mark me, the patient will feel better by gentle rubbing of the face. The toothache will be better by rubbing the face. In belladonna, toothache will be from inflammation. In chamomilla, the aggravation will be from warmth. In Hecla lava, toothache from swelling about jaw, abscess of gums. For headache also, we have all these medicines, chamomilla, gelsemium. Chamomilla में headache will be after anger. Spigelium में neuralgic headache रहेगा. Bryonia में all the common symptoms we have for headache. In Bryonia, we have headache with constipation. In gelsemium, it will be better by profuse urination. So yeah, after this we have अगर eruption कुछ होता है तो sepia, skin disease होती है tip crude, third day rash होती है और convulsion है तो cuprum. Okay. Okay, ichthyolum you can use in chronic urticaria, excessive itching. Sepia for ringworm, caladium, itching with asthma. For licoria, we have cocculus, creosote, and all these medicines. Here you can differentiate it based on the character of discharge. So these are two cases which I have taken from this Yingling's repertory. And here he has used his own repertory and prescribed. That is a beautiful case. You can see. Uterus seems to go up. Instead of descending, the uterus was in upward position. And based on this symptom, he prescribed semicifuga 10M. And the delivery was normal. Fetal movement absentee. ऐसा लग रहा था कि now the patient has, the baby is no more. So fetal movement slow down, almost imperceptible. Okay, threatening abortion. Plumbum met is the medicine given here. Oh, sorry, that was sepia was given here. And this was another case, abortion occurring. And reason for abortion was retroverted uterus. And here you can see plumbum met was prescribed. Now, with all this learning after all the rubrics and medicines, the important thing is we should have confidence. That is most important, confidence in our pathy, confidence on our own self, that yes, medicines do act. Definitely we have rubrics and medicine for each and every complaint. We should be just confident that हम prescribe कर सकते हैं and that is going to give relief to our patient. So pregnancy is intended to be a joyful and fulfilling period. However, various complaints can transform this phase into a challenging experience accompanied by unnecessary discomfort. Homeopathy offers solution to alleviate this issue, aiming to ensure that the journey of pregnancy remains a cherished memory. Numerous resources authored by experts in the field are available for reference. Novices in this area are advised to explore this material. Consider homeopathy for happy mother and healthy child. So yeah, that is the thing that we do have everything given on our plate. All we need to do is utilize it properly. So that is all. That is how I try to include all the repertories, all the rubrics, all the medicines which we can use for females and give them a little comfort during their transformation, during their journey. So I hope this session will be useful and helpful to each one of us, and this will boost a little confidence to prescribe to pregnant female in our clinic, at our homes, and everyone. So, and if we can help a little bit, so that will be great service to humanity, I think. I again thank NIH Alumni Association for giving me this opportunity. It was really a privilege to have to be here as a speaker, and I was really honored. I'm really honored. So I again thank you to Dr. Kalyani sir, Dr. Bidyut Mukherjee sir, thank you to Dr. Shishir Singh sir, and thank you to all our viewers for patient listening. It was a very long session, but I hope it was helpful. Thank you so much. Over to you, Dr. Arka. Awesome.
Yes, it was covering all the aspects of antenatal care. I think, uh, as we know, that WHO guidelines or guidelines issued by India government. So both are telling that we should have taken care of since first trimester what the complaints will come and what you have to understand. Uh, um, Taking regular BP and weight and fundal height, all the hemoglobin concentration starting from the day one when the female is coming. So,
Mm.
so that's why I was telling that antenatal care was very important. And I want to add this thing, one more thing that government is doing. Uh, Whenever patient is coming to you, you can uh, educate them about the JSY, that is Janani Suraksha Yojana. That is
Mm.
a conditional cash transfer scheme to promote institutional deliveries. Whenever a poor patient is coming to us, so apart from giving medicine, we can suggest them ki, because they are not aware about this, so we can suggest them ki the government is giving cash money for uh, better delivery in a institutional delivery. And there is one more scheme that is called Pradhan Mantri Surakshit Matritva Abhiyan. This Matritva Abhiyan matlab ki though the whole that what Dr. Heena was talking about the journey of this motherhood. So in that there are requirements of some nutrition, there are requirements of some diagnostic tests, and there are requirements for it may be a pregnancy which requires the utmost care. So for that, the this scheme is there and it is free of cost. And uh, every ninth day of the month, the government is providing that support to the mother. And you can suggest the patients, poor patients, that you can go and you can have this much of consultation, or you can take this benefit actually. And what Hina has covered, yes, definitely it was a uh, big task, but how beautifully she has covered within 1 hour, starting from the nausea, which everybody talks about. And we have seen in the movies also कि जैसे nausea आया तो पहला होता है कि नहीं नहीं इसका मतलब प्रेगनेंसी है. तो वो जो सिम्टम मिलता है, तो स्टार्टिंग फ्रॉम दैट सिम्टम हिना ने स्टार्ट किया. एंड मेडिसिन कुकुरबिटा, इपिकाकुएना, सिम्फोरिकार्पस, लिलियम टिक, जो बहुत अच्छी अच्छी मेडिसिन हैं, शी हैज टोल्ड अबाउट दैट मेडिसिन. एंड then the pain in the breast starts, and about those shooting pains, shooting memories, induration and inflammations, CPR, Calcarea Fos, Briania alba, Conia Mac, beautiful medicines and their indications. Then the constipation also, because as the gravida is increasing and there will be constipation. So for that, alumina, dolichos, colinsonia, natramure, and other medicines also, as the bladder is now compressed, so there will be pain in bladder, and that the pain may be unbearable. For that, salsapilla can be think of, cantharis can be think of, ecositum, creosotum, है ना? And as soon as the third trimester is coming up, so there are, you can say, because of the uh, familiar pressure or something, that WHO is also telling during the pregnancy time, the mental health should be taken care of. And for that mental health also, now Hina has moved towards the mental health. And then she has covered the mania, irritability, strange notions, taciturn, and suicidal melancholy, and fear of be alone, darkness, ghost, जो अक्सर मिलता है, एंड फियर राइडिंग इन कैरेज. हमने देखा है कि जब भी फीमेल जाती हैं कार में तो उनको बहुत डर लगता है, तो दैट इज. एंड एलिमेंट्स फ्रॉम फ्राइट और चेंजेबल मूड, बहुत अच्छा जो इग्निशा में हिना ने बताया, चेंजेबल मूड वो बहुत देखने को मिलता है. उसके बाद आता है बैक एक, धीरे धीरे नीचे बैक एक में आने लगा, एंड बैक एक अफेक्टिंग सैक्रम एंड हिप्स एस्कुलस बताई. फिर हिस्ट्री ऑफ बैक एक आफ्टर अबॉर्शन, ड्यूरिंग लेबर, ऐसा कैलिकार, बर्बरिस बर्गेलिस, सरसा बेल्ला, रस टॉक्स, अच्छी अच्छी मेडिसिन में उसने उन्होंने बताया. इसके बाद आ गया पैरों में सूजन आ जाती है, फिडलिडीमा, उसमें भी एपिस मेलिफिकस, कॉल्सिकम, डिजिटलिस, आर्सेनिकम एल्बम, जिंकम मेटेलिकम, ये सारी मेडिसिन कवर करते हुए वो फिर इस तरफ आई वेरिकोज वेन में, क्योंकि वो सब जो है ना, जो सर्कुलेशन जो अब हैम्पर हो रहा है और सिटिंग पोजीशन है, वो जाता है फिर वेरिकोज वेन में, और बहुत सारे फीमेल्स में वो बाद में भी रहता है आफ्टर प्रेगनेंसी ऑल्सो. एंड फेरामेटेलिकम, पल्साटिला, हेमेमेलिस, वेरी नाइस मेडिसिन, एंड शी हैज टोल्ड अबाउट. फिर गैस्ट्रिक कंप्लेंट्स, पल्साटिला, फॉस्फोरस, स्टमक डिसऑर्डर्स में फॉस्फोरस, फैट और मिल्क जब भी खाते हैं, है ना, एटोनिक डिस्पेप्सिया, नक्स वोमिका, सार टेस्ट, मुंह में खट्टा खट्टा रहता है, मैग्नीशियम कार, वो सब जो मेडिसिन हमारे दिमाग में आनी चाहिए ड्यूरिंग दैट टाइम. एंड फिर आया स्लीपलेसनेस, क्योंकि अब जो है वो रात की नींद जा रही है धीरे धीरे, अब उस स्टेज में पहुंच गई हैं फीमेल्स. तो उसके लिए भी कार्बोवेज, पल्साटिला और इलैप्स कोरल, कॉल्सिकम, लाइकोपोडियम, स्लीपी ड्यूरिंग डे लाइकोपोडियम, बहुत अच्छा बताया आपने. एंड उसके बाद लेबर पेन में आ गए, है ना, जो अब स्टेज आ गई है थर्ड ट्राइमेस्टर के बाद. लेबर पेन में भी टेंडेंसी टू फेंट, एग्जॉस्टिंग, एंड मस्ट स्टैंड और वॉक अबाउट विथ फ्रीक्वेंट यूरिनेशन, कैमोमिला आपने बताया, and coldness of skin, and that camphora is covering, faintness, secula is covering. So that the very beautifully actually you have designed your slides, so much of dedication, that slowly and gradually you are moving different covering the different aspects of the this antenatal care. Then uh, वो जो feeling very hot, covered with hot be during, and then flatulency. Then coming to the, she want to be covered up more, false pains, and सीकेल कॉर वाला जो आपने बताया था वहाँ पे. अब आके जब लास्ट में एएनसी हम आगे थे, तो वहाँ पे ड्यूरिंग परप्यूरियम भी आपने कवर किया, दैट इज वेरी गुड, वेरी नाइस पॉइंट, जिसमें आपने हेमरेज भी कवर किया, रूब्रिक सारे बताए आपने. और पोस्टमार्टम हेमरेज में बेल, कैमोमिला, फेरम, एपिकाक, नाइट्रिक एसिड, और covering with the nerve repertory you have covered, and cantharis, semicifica. एंड उसके बाद जो दांत में दर्द आ जाता है वो भी आपने बहुत अच्छे से कवर किया, मर्क्यूरियस, कैमोमिला, हेगला लेवा, बेलडोना आपने बताया. और कवर करते करते फिर आप इधर जो इचिंग स्टार्ट होता है, क्योंकि अब जो 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 हार्मोन्स का जो था, फिर एंजाइम्स का जो काम खत्म होते होते अब लीवर पे थोड़ा सा प्रॉब्लम आया, तो इचिंग ऑल्टरनेट्स विद एस्मा, वायलेंट इचिंग बिटवीन लेबिया एंड टाइट्सनेस, कोरियो जो क्रियोजरम आपने बताया. सो दैट इज ऑल्सो वेरी वेल कवर्ड. उसके बाद वेजनल डिस्चार्जेस आ जाते हैं, तो उसमें भी पल्साटिला, क्रियोजोटम, एम्ब्राग्रीसिया, थिक ब्लूइश वाइट लिकोरिया, वर्स एट नाइट. So, or that case also you have covered. I think beautifully you have covered, and take home message, yes, happy mother and healthy child. Everybody now carry this take home message. um, any questions from any side that we can take up? So um, one question is there, mention and comparison of different remedies in different conditions and illness during antenatal period. अच्छा, ये तो अरिजीत पाल ने आपके लिए बोला है. So my question is, when to prescribe homeopathic medicine as many conditions are considered normal gestational symptoms. है ना, एक क्वेश्चन है, अरिजीत पाल चौधरी जी सर ने पूछा है. My question is, when to prescribe homeopathic medicine as many conditions are considered normal gestational symptoms. I think many conditions are not considered, because once the condition is normal, so that can be related to the normal pregnancy complaints also. So हल्का फुल्का nausea, हल्का फुल्का चलता है, लेकिन जहाँ पे पेशेंट को प्रॉब्लम आ रहा है वो दिन भर उसके बारे में सोच रहा है, दैट शुड बी टेकन केयर ऑफ. बाकी तो जैसे मैंने देखा ना, जैसे हिना ने हर चीज कवर किया, स्टार्टिंग फ्रॉम नोजिया, फिर एब्डोमेन पेन, फिर बर्निंग यूरिनेशन. तो आई थिंक व्हेन द पेशेंट इज कमिंग एंड एक्चुअली पेशेंट तभी आता है जब उसको वो प्रॉब्लम अनबियरेबल हो जा रहा है, या लग रहा है कि हाँ नहीं भैया अब मुझसे नहीं हो पाएगा, तो भी आता है. और अगर ऐसा प्रॉब्लम है भी कि जो हमें लग रहा है कि नॉर्मल है, तो हम पेशेंट को we can educate her that this is normal. Actually during pregnancy you will feel like this, you will have the burning urination, you will have the frequency of urination, you will so we can tell the normal symptoms and we can console the patient. Otherwise if it is required we can give the placebo also. और मैं हिना से भी पूछना चाहूंगा कि वो उसमें क्या बोलना चाहती है. हिना आप बताइए.
नो सर, सेम सेम जो आपने बताया, दैट इज व्हाट द इंटेंसिटी इज इम्पोर्टेंट, कि नॉर्मल और नॉर्मल रहेगी जो चीज और जो सिंपल बन जाएगी, द इंटेंसिटी विल डिफर. तो अगर एक पेशेंट इज कमिंग टू यू एंड सेइंग कि ये चीज हो रही है, दिस कंप्लेंट इज दैट मींस डेफिनेटली वो उससे परेशान है, दैट इज ट्रबलसम टू द पेशेंट. एंड इन ऑल सच कंडीशन व्हेन पेशेंट इज सीकिंग हेल्प, वहां पर हम मेडिसिन प्रिस्क्राइब डेफिनेटली करेंगे. एंड इफ वी फील, वी डू हैव दैट सेंस, वी कैन जज कि यहाँ पर अगर लग रहा है कि नो दिस देयर इज नो नीड ऑफ मेडिसिन, सो वी डू हैव दैट placebo or second best medicine to prescribe. So we know when to when it is normal and when it become a symptom. So intensity will help us to decide.
Yes, definitely. And if patient is coming also, so we have to be taken care of the socio-economical condition of the patient also. कि sometimes वो उसका फैमिली में उस पर अलग से प्रेशर आ रहा है, कुछ और मेंटल प्रॉब्लम तो नहीं हो रहा है ना, उस समय भी पेशेंट जो है, तो दैट एंटीनेटल केयर में वो सब भी बहुत अच्छे से हमें पेशेंट को मतलब एक तरह से एम्पैथी के साथ देखना पड़ेगा, ताकि वो उसके बच्चे पे इफेक्ट ना पड़े, क्योंकि प्रेगनेंसी के समय जो कुछ भी वो झेल रही है वो उसके बच्चे पे आ सकता है. और उनको एजुकेट भी करना है कि अच्छी डाइट लें, स्मोकिंग ना करें, अल्कोहल ना लें, है ना. सो वो सब भी उनको जब डॉक्टर बोलेगा तब उनको समझ में आता है कि नहीं हमें ये नहीं लेना है, अदरवाइज दे विल बी अकस्टम टू हमें रोज तो एक सिगरेट पीना, ये तो पीते ही हैं. तो बेसिकली जब डॉक्टर के पास आए तो डॉक्टर को और होम्योपैथ का भी फर्ज बनता है कि वो उनको समझाएं कि ऐसा ना करें. हाँ, और कोई क्वेश्चन तो अभी नहीं दिख रहा है, और आपने बहुत अच्छे से कवर किया. It was full. Actually, whenever any person want to think about antenatal care, so they can watch this video, because this video is available and they can get the help of हाँ मुझे इस प्रॉब्लम में ये मंथ में ये प्रॉब्लम आ रहा है, तो दैट इज कवर. और एक बात मैं अच्छा, राजबाला ने इनॉग्रेट किया था, तो राजबाला को भी अच्छे से जानता हूँ, एंड शी इज वेरी काइंड हार्टेड डॉक्टर. उसको मैं बहुत अच्छे से जानता हूँ, और उसको भी थैंक यू. और विद्युत सर जो अरेंज करते हैं इतने मेहनत से, उनको धन्यवाद. और कल्याणी सर, हमेशा उनका आशीर्वाद रहता है, और इतना उनके जैसा भी हम लोग सोचते हैं कि कितना मेहनत से काम करते हैं हम लोग, पता नहीं उस एज में कितना काम नहीं कर पाएंगे, नहीं कर पाएंगे. और साथ साथ में जो सबको दिख रहा है सीएमई हो रहा है, बट सीएमई के पीछे सीएमई हो रहा है वो हमारे पीछे जो अर्को जी हैं, उनका बहुत बहुत थैंक यू है, क्योंकि पूरा एकदम डिजाइन करना, पोस्टर बनाना, पोस्टर में कहाँ पे कितना सुंदर फोटो बनाया है। इसमें मैं तो थोड़ा सा जलन कर रहा हूँ कि हिना का इतना अच्छा फोटो डाला है, मेरा नहीं डाला है, लेकिन बहुत अच्छा बनाया है। मतलब और इतने बिजी के बाद शी हैज टू डू हिज स्टडीज, उसका उसको अपना आगे भी फ्यूचर भी देखना है, सब कुछ करना है, उसके बाद भी मेकिंग दिस सीएमई सक्सेसफुल। अर्को को मैं बहुत बहुत धन्यवाद बोलूंगा, और आपका तो धन्यवाद है ही हिना जी। और मैं बुलाना चाहूंगा अभी, अगर विद्युत सर हो ऑनलाइन तो उनको बुलाना चाहूंगा। कल्याणी सर भी हैं हमारे बीच में सर।
Good evening. Thank you, Shishir sir. Dr. Heena, we are really proud of you. It has
Thank you
been
so much.
awesome. And the main inspiration behind all this program, our great leader, Dr. Devnaran Kalyani sir. Please, your views on the session. Sir, no sound.
No, it's mic is off, I guess.
Kalyani sir, please remove your headphone if possible. Please remove your headphone if possible. Maybe that's the issue. Sometimes headphones are the issues in this platform. Please remove the headphones from your, and also just open the jack from your mobile device if possible.
Kalyani sir is
Remove the mobile jack also, sir, if possible. Remove the mobile jack also, like totally remove a headphone from your phone totally.
सर मोबाइल से उसका पिन निकाल दीजिए।
हाँ
Just
सर का
remove the
थोड़ा
pin.
प्रॉब्लम है. Sir is asking for help.
Mhm.
As Shishir sir had said, at the age and with all the challenges, health challenges, what Kalyani sir is going through, he has been there in each and every episode of our CME.
No,
And
sir.
that
Kalyani, sir,
inspires us.
please just remove the jack if possible. স্যার জ্যাকটা খুলে নিন যদি সম্ভব হয় স্যার। হেডফোনের জ্যাক, হেডফোনটা যেটা লাগানো আছে দেখছেন ওইটাকে খুলে নিন স্যার।
Sir is trying to get it done.
না স্যার, স্যার হ্যালো হ্যালো করছেন, শুনতে পাচ্ছি না ওই জন্য।
Sir আসছে না, এখনো আওয়াজ আসছে না. Divya, if you are watching this episode, please tell someone to help Kalyani sir. Dr. Divya Kalyani, if you are watching the episode, please tell someone to help Dr. Kalyani sir.
Just
Sir, সাউন্ডটা ক্র্যাক করছে.
না না স্যারের আসলে হেডফোন জ্যাক এখনো কানেক্টেড আছে স্যার, কান থেকে হেডফোন খুলে দিয়েছে, বাট মোবাইল থেকে এখনো আনকানেক্ট করেনি মনে হয়। হেডফোনটা খুলে দিতে বলুন। Just remove the
सर वो
headphone completely if possible. Remove the headphone from
আসছে
सर
না.
कनेक्शन निकाल दीजिए सर, कनेक्शन जहाँ पे है ना वो पिन निकाल दीजिए, तब आ जाएगा आवाज। हेडफोन
বৌদি
को सब
যদি
बंद।
ম্যাডাম যদি শুনতে পান, আহ, তাহলে স্যারের মোবাইল থেকে হেডফোনের জ্যাকটা খুলে দিন. It got disconnected. Anyway,
सॉरी सर।
we are trying to reconnect, sir, but Really, Dr. Shishir, as you said, it's has been a great motivation for all of us to see Dr. Kalyani sir suffering from so severe health challenges, and for the service of homeopathy, he is there in each and every CME episode. He is trying to motivate all of us so that we all stay here and we continue on with the CME. Now sir is back again.
এখনো নেই আর আমি।
Sir, आवाज আসছে না. We can't hear you, sir.
Sir, please remove the headphone completely, not from your ear also, like from just remove the headphone from your phone also, if possible. Just remove the jack, remove the pin.
Uh, so far, let's get wait for Kalyani sir to get connected. Yes, sir. I think Orko, can you hear, sir? Orko?
Hello, sir. Please remove the pin, sir. Please remove the pin if possible. Please remove the pin, sir, if possible. Remove the pin.
স্যার এবার একটু বলুন।
এখনো পিন রিমুভ করেননি স্যার।
স্যার রিমুভ করে দিয়েছেন বলছেন।
তাহলে মনে হয় কোনো এই সমস্যা হচ্ছে তাহলে।
স্যার মেবি network challenge. We'll try to connect you over mobile directly, sir. We'll try to connect you over mobile after this session. For Sishi sir, there has been a request from all of us. We are eager to see the neonatal care unit
सर आपका भी आवाज नहीं
as
आ रहा
well
है
as
विद्युत सर।
I am getting the sound, but maybe somewhat everyone is facing this
also.
sound issue. I guess everybody is facing the same sound issue, I guess. CC sir, can you hear me, sir? CC sir,
कुछ
can you hear
टेक्निकल
me?
प्रॉब्लम है थोड़ा सा ना इसमें आवाज नहीं आ रहा है एक्चुअली और हेडफोन लगाने के बाद तो और नहीं
हाँ
आ
अभी
रहा
आ रहा है।
दैट्स व्हाई आई एम टॉकिंग विद दिस
अभी आ रहा है।
डायरेक्टली
Shishir sir
हीना
is
आपको
अभी
not
आवाज आ
आया।
रहा है
getting the. मेरा आ रहा है तो सर? Are you getting my
मेरा
voice,
आवाज
sir?
आ रहा है।
Dr. Arko, sir, both you are audible to us. I think sir के
maybe
पास नहीं
CC
था.
sir फिर CC sir सुन नहीं पा रहे. I am getting contact with him. I am getting in touch with him. Uh,
Yeah.
you guys
Okay.
just carry on.
Yeah, yeah. Our humble request to the administration of NIH that we are eager to see a functioning neonatal unit as well as the delivery to start, because a lot of our teachers over there, I'm not mentioning the name, they had their kids, means those children had been delivered at NIH itself.
Mm.
Our many respected teachers and those kids are now pursuing technical education, and that also the delivery, the process, the mother and child health care, everything was done through homeopathy. So we were waiting to hear from Kalyani sir, but due to certain technical issues we cannot get in touch. Hina, it had been a awesome session, and till now in the YouTube studio I can see 200 live viewers in the
Okay.
YouTube, and
Uh,
I cannot check the Facebook, which you will be getting it afterwards. But it's something awesome. And as Shishir sir had said, that people should come back to this episode and watch it again and again. Your entire the session has been outstanding. And Orko, can we connect Shishir sir again? And
Yes,
Kalyani
sir.
sir? Yeah.
I'm the,
Yes, sir. Shishir sir, as the technique, due to technical reasons, we cannot get Kalyani sir connected. So you being the moderator, kindly close the session. Kalyani sir, can
uh,
we connect?
सर जैसा आप ऐसे कर दीजिए हम लोग कंक्लूड कर देंगे कुछ भी आशीर्वाद आपका चाहिए ड्यू टू टेक्निकल रीजंस इट हैपेंस एक्चुअली तो नेट में फ़ायदा भी है नुकसान भी है तो बट इट वाज अ नाइस सेशन थैंक यू डॉक्टर हीना थैंक यू डॉक्टर राजबाला and thank you Vidyut sir thank you special thanks to Kalyani sir for always motivating and supporting us thank you so much and now we can conclude the session and good night to everyone thank you so much
thank you
Good
so
night.
much, sir.
Good night, everybody. And we'll be meeting again on CME number 128 on 24. It will be on 23rd, on 23rd of November. It will be on 23rd of November, and it will be again a sharing of experience by two established practitioners and obviously alumni of NIH. Till then, good night, everybody. Back to our backstage editor, Dr. Orko Mukherjee.
Thank you to all the panel members. Thank you, Sisi sir. Thank you, Enadi, for acknowledging me. Also, acknowledging me, and also to all the viewers. Thanks for watching. I hope you have enjoyed today's CME, and if you have enjoyed, please do make sure to give it a like, share with your fellow mates, and don't forget, if you're on Facebook, come to YouTube and please do subscribe our channel. Click on the notification button, that bell icon, and click on all so that you get notified as soon as we get scheduled. And also you can join our WhatsApp channel. Over there we also schedule our CMEs way before than anything else. If you want to get update on there too, it's over there also. You can join there. And those who are watching on YouTube, also go check our Facebook page. The link is in the description, and also it's not the link, maybe the ID, but you can search on Google. It's totally you can search on Facebook. It's totally available there. And also to all the viewers, let me just tell you one thing, that you have just 2 more hours or less than 2, maybe 1 hours 56 minutes, something like that, to fill up your auto e-participation certificate of this CME. Then from, like, as soon as the bell hits in 23:59 in 24-hour format, and in 12-hour format if it hits 12 a.m., then you have to say like 11:59 p.m., then we will close the backstage means we will close the auto participation certificate, auto generated e-participation certificate portal. So before that, take your e-participation certificate, fill up the forms, and also we are back on track with the e-participation certificate. Hats off to the IT team. And also with this, thank you again. Thanks for watching. See you in our next CME. Until then, it's me, Orko Mukherjee.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.